So today we're going to talk about, is infertility on the rise in the United States, and should you be worried about it? So unfortunately, the answer seems to be yes. Sperm counts have declined up to 50% in the last 4 decades, and they're projected to decline an additional 1.4% each year moving forward. The birth rate in the US fell for the first time in decades in 2017, and we know that about 1 in 4 couples struggle to conceive. So that's not the only thing that contributes to the declining birth rate. There's other socioeconomic factors, but I think everybody has known someone in their life who struggled to get pregnant or had to use IVF or IUI to get pregnant. So unfortunately, the answer is yes, infertility is on the rise in the United States. Should you be worried about it? Well, let's take a look at some of the causes.
Okay, so the first cause is advanced maternal age. So basically that means that women are having babies later on in life. Used to be, you had all your kids by the time you were 25 was old.
It seems so young now.
Yeah, you were done. You were done. And that's just not what we do anymore. And there's so many factors, we're working and things like that. So women are tending to have their children in their late 20s, commonly in their 30s, sometimes even in their 40s. So eggs are getting old. Your eggs decline, they die off over time, so we don't have as many, and they aren't quite as vital as you get older. So that is a factor that contributes to infertility.
And that certainly doesn't mean you can't get pregnant at a later age. We have women in their 40s who get pregnant pretty routinely, but it is more difficult and it takes longer in most cases. So that advanced maternal age is certainly a factor. What else?
Okay, so our environment, and specifically toxins in the environment. So the toxicity in the environment has been increasing over time, and they're everywhere. You cannot avoid them. So some examples are water, contamination in the water, drinking from plastic water bottles with BPA leaching into water. Our air, if you live in Phoenix, we've had ozone warnings all summer long. The air is not healthy.
Our air is horrible.
So breathing and drinking. In our food supply, preservatives, pesticides and herbicides are prevalent in all of the food that we eat, unless you're growing everything at home. Then things like body care products, skin care, shampoo, conditioner, deodorant, everything that you use on your body every day, shower, wash, everything like that. They do have chemicals in them. I think there's like 180,000 chemicals that are present in our body care products today. That's kind of a scary number. I mean, even if you're really clean in all those areas, I mean, you go into buildings where pesticides have been sprayed, restaurants, they have to use pesticides because we don't want bugs in our food. And so just in, they spray the grass.
There's an accumulation of these things, and we know both from the research and from clinical experience that accumulation of chemicals and environmental toxicity has a detrimental effect on fertility and hormone balance.
Right.
So that's the second thing, advanced maternal age, accumulation of environmental toxicity. The third is our lifestyles. The standard American lifestyle typically has poor nutrition, poor sleep, both quantity and quality. We live very sedentary lives. Only 20% of Americans even have a gym membership, let alone use it. And we know these things have an effect on fertility rates. A reduction in body weight of just 5 or 10% can dramatically improve your chances of getting pregnant, and that kind of ties into that whole lifestyle thing, not just poor nutrition, but poor sleep and inappropriate stress management skills, which leads us to the last thing, which is too much stress, or what I consider to be busyness. We just don't have space or room in our lives anymore for enjoyment, social connection, exercise, things that kind of make life worth living. We're so busy, and our bodies perceive that as being too stressed out. And if you're too stressed, your body's not going to think it's a good time to have a baby. You just don't have the extra resources to get pregnant and sustain a pregnancy. Not to mention the effect that these lifestyle and stress related conditions have on male fertility as well. So those are really the top 4 reasons, in our opinion, in our experience, why infertility is on the rise in the United States. So should you be worried?
It's not all doom and gloom. So we do have some control over some of these things, and we don't have to live in a bubble. So we do have some control, and that's one of the things that we do is we work with patients and help them identify some of the risk factors and how to reduce those. We can't make you younger. That one,
Not yet.
But, right.
Yeah, so we don't necessarily think you should be worried because there's a lot of things under your control. You can improve your lifestyle, improve your sleep quantity and quality, lose weight if that's a factor. You can learn how to manage your stress and kind of mitigate that busyness in your life. So it's absolutely possible and probable for you to improve your fertility and not be that statistic, not contribute to that decline in infertility rate in the United States, which is really, really sad. Right, so let us know what questions you have. You can leave a comment below. Maybe share this with someone who is worried about future fertility, or just kind of paying attention to the fertility rates in the US. Right, thanks for watching.
Take care.